Patel, I would like to talk to you about if a patient often, sometimes has a, missing teeth, misaligned teeth, that sometimes you dentists find that lots of the problems a patient has, for instance, a headache, even other things such as shoulder pain, knee pain, it might literally come because of misaligned teeth, especially headache, shoulder, and neck pain. And some patients apparently have tried for years to get rid of it, only to finally find out from a dentist that what you needed to do is grind a few teeth down, do this, do that, and it's actually a small procedure in often, and bang, years of trauma gone. True, or is there something doing to that?
Absolutely 100% true. This is one of the biggest issues that we face in dentistry. We spoke about periodontal disease earlier. That is bacterially, it can occur from bacteria standpoint. It also occurs from a bite-related standpoint where you lose the supporting tooth structure. So in essence, what happens is if my face was a tooth and the patient had removed a tooth and not replaced it, what tends to happen is teeth start shifting, and they're going to shift in an uncontrolled manner. And when teeth shift, your bite starts to change because now the lower teeth, they also start moving in a manner that the upper teeth are moving in. So when teeth start shifting over the years, this is known as a bite collapse. What happens in a bite collapse is it has a toll on the muscles of our jaw, which kind of holds or controls the movement. When I flex my arm to make a muscle, it's not my bones that are moving. It's basically muscles that are making my arm flex. Same way, our lower jaw is controlled by muscles in our mouth, in our neck, and as well as in our back of our neck. This is a branch of dentistry which is becoming extremely popular. It's called neuromuscular dentistry. And the basis of neuromuscular dentistry is that your bite controls or has an effect on your overall posture. Maybe a very hard thing for patients to assume or to comprehend at this stage, being that it's a very early form. But neuromuscular dentistry also, because your muscles are in a state of dysfunction due to missing teeth or a bite that is not aligned correctly, a consequence of that is always migraine headaches. And patients do have migraine headaches, and the dentist is unfortunately the last persons in the world that they will think about. Many patients suffer from migraine headaches that could be fixed for the most part by visiting your dentist. And we have a treatment here that it's called the Trudenta treatment that we actually administer to patients, in which we treat these muscular dysfunctions and bringing everything back in sync.
Is it usually a very extensive and heavy treatment, or not necessarily? Shed a little bit, just a little bit of light on it of what it's like. Are we talking a major operation, costly? What are we talking about here?
No, as a matter of fact, it's not a very costly treatment. It is a very minor treatment. It is very non-invasive, and the basis of it starts with a guard. The basis of it starts with identifying of the 5 major muscle groups or muscles that actually control the jaw, where we call these trigger points. Trigger points are areas in the muscle where the fibers of the muscle kind of bunch up and they become really hard. And when that happens, the full muscle does not have the ability to function in the manner in which it does. So it's identifying these trigger points, is using laser therapy in relieving these trigger points so that the muscle does have the full flexibility. It's analyzing the bite, and it's correcting the bite. So no, it's not a very invasive treatment. Cost factors are obviously related to the severity of the bite correction that has to be made. And eventually it has an effect on our TMJs. This is known as TMD, or temporomandibular disorder, which we also try and correct.
So basically, the base, the muscles, everything gets a little bit out of wacko. The muscles have to compensate, and eventually that leads to all kinds of pains around the head, shoulder, and neck, and stiffness, and it can be fixed. And it is one of the last places most people look. Even many MDs and people, they're not yet sending, you know, like, it's okay for any doctor to say, okay, let's look at this, let's look at that, and rule out certain things. But it looks at this moment that most MDs not yet into like, okay, we couldn't fix that for a few months, and instead of like giving you pain tablets on a regular basis, go and see a dentist and mention it specific. So I think we should, anybody, and we should, you know, I think every dental office should have a huge sign in the somewhere and say, if you have headaches, neck, shoulder pain, a little more than you think you should have, point it out to us so that we can check your, you know, to see whether your teeth are aligned the proper way and not the cause of it.
Absolutely. One of the drawbacks to our medicinal thinking in this day and age is, you know, we know for a fact that everything in the human body is related in some way, shape, or form, but it just has not been proven yet. And we're starting to slowly get into that phase. As I mentioned, it's neuromuscular dentistry, which a lot of the doctors and physicians are not aware of. And that lack of knowledge is what does not give them the good ability to pointing the patient in the right direction. We're doing a lot here in Lower Bucks County in trying to educate some of the doctors as to some of these issues that are dentally related, which medicine may not be able to correct. And we're finding a good amount of success with that. So it's just a matter of educating the doctors in these neuromuscular issues, in these periodontal disease issues, which would eventually go ahead and have them point the patient in the right direction, which is ultimately, with these issues, their dentist.
Well, at least for sure, you can point and point it out to the patients themselves. Right?
Absolutely.
Let me give you a very big piece of doctor advice, even though, you know, I barely went to high school. Anyway, I'll give you, you know, it was a person actually in Bombay who told me that. His name is Mr. Balaria, many years ago, maybe 10, 15 years ago. There was this gentleman who had a tremendous amount of ringing in the ears all the time for years. And he went to every and all specialists. He went to other countries, you know, even though it's a very big misconception to think that countries like Mexico or India do not have good medicine and good this. It's just not true. I frequent a lot in these countries, and they do have everything very good. Sometimes you could sometimes go to a guy in a bonus city which he doesn't have the good equipment because he didn't have the money to get it. Then you might be not so well off. But if you go to normal doctors who have all the equipment needed, they're just as fine. So anyway, so this particular patient went to many different countries to figure out, well, and he couldn't figure it out. So anyway, we lived with it. And so one day he goes and buys shirt with his tailor. And the guy, he says, you need 42. Your size shirt is 42. And the person said, no, my size is 38. I wear 38 all the time. The tailor said, no, it's 42. He says, no, come on, it's 38. I always have 38 my whole life, and I didn't gain a pound at 38. He says, no. The tailor said, if you wear 38, you get ringing in your ears.
That was good. That was a very good one. I agree.
So anyway, and this is a little bit like that. You know, we are looking. We too often, even though we are so educated on it, so many educated people, but in the end, it seems to be human nature to look for the problem where it hurts, so to say. You understand?
Sure.
Business people do that. We have no money, so they look for problem in a particular area when the problem is somewhere totally different. You know what I'm saying?
Absolutely. Absolutely.
Sometimes not even in the business. I mean, literally.
No, you're absolutely right. And you know, that is basically the beginning point. But what we do here is, you know, there's a very thorough medical examination that we go through with the patient. We spend a lot of time with them, knowing their medical history, even though they may not feel it's important. It's important for us to understand that. We also have a very extensive dental history questionnaire that we go through with patients, and that's how we come about, you know, figuring out or diagnosing treatments that patients will never have thought of. That a dentist could treat. So it's all in understanding the patient first before you go ahead and start looking at dentistry, for example. You know, dentistry is the last thing that I usually worry about. The first thing is figuring out what the patient's medical situation is, their dental situation is, what their needs are, and then moving from there.
Right. Well, it makes a lot of sense that, and it's good that overall medicine, from whichever area it comes, that this awareness becomes about, that we start realizing the enormous importance about dentistry. It's not about losing teeth. As I said a long time ago, a little while to you, your degree only. Losing a tooth is the easiest to fix because dentistry is so good that an implant tooth, a crown, a bridge is not that difficult and not that handicapping anymore.
Sure.
But all the other things which go with it and which are there while you're losing a tooth, like periodontal, you're poisoning your body like crazy for 1, 2, 3, 6, 10 years till you finally lose the tooth at that point, and you wonder why you had a cold 4 times a year and otherwise weak and tired and exhausted and whatever. You understand? And it
you're absolutely right.
Yeah.
You're absolutely correct.
Very, very enlightening, Dr. Patel. Thank you very much again.
Thank you. All right.